Hello. First off, I would like to thank the Dundee Green Health Partnership for organizing this Green Health Week despite the difficulties brought by the COVID-19 pandemic. Today I'm going to present the mechanism and context of prescribing blue space interventions and green pharmaceuticals developed with excellent supervision by my advisors from Glasgow Caledonian University, the James Hutton Institute, Centre of Expertise for Waters, Scottish Environment Protection Agency, National Health Services Highland, and Queensland's University Technology. My research is funded by the Scottish Government's Hydronation Scholars Program. Just a quick introduction. My name is Julze Alejandre, and I'm a public health nutritionist and health promotion specialist. I have worked as a health and nutrition program manager for the Philippines Health, Nutrition, and Social Services departments. And before joining the Hydronation Scholars Program, I did my postgraduate degree in public health and health promotion at Bangor University in Wales, where I investigated the impact of green and blue spaces on childhood obesity. The healthcare sector contributes significantly to greenhouse gas emission and environmental pollution through direct and indirect sources. Aside from carbon emission of pharmaceutical acquisition, active pharmaceutical ingredients pose serious risk to water bodies and aquatic organisms, affecting the behavior and life cycle of underwater wildlife. Despite these risks, medicine is still an essential commodity in healthcare. Thus, there is a need for sustainable health strategies that will reduce pharmaceutical concentration in the environment without compromising public health. Prescribing blue space interventions and green pharmaceuticals have been recognized as one of the environmentally friendly practices in healthcare. However, contextual implementation of these interventions is scarce or conducted in pilot. Blue spaces have been proven to have positive impact on human health and well-being. These are natural stress reducers providing fresh air that regulates temperature, soothing soundscapes that serve as noise abatements, and biodiverse ecosystems of flora and fauna that fascinates our human minds. This biodiversity, low pollution levels, and regulated climates were associated to high quality of life and positive influence on humans' physical, mental, and social health and well-being. Plenty of scientific studies have demonstrated the impact of nature, green and blue, on human health and well-being. A study by Matthew White and colleagues had shown that spending 120 minutes per week in a blue space environment could increase the likelihood of individuals reporting good health or high well-being. In addition, a longitudinal study by Chegas and colleagues also ascertained that living close to a regenerated canal in Glasgow, around 500 meters, could lead to overall decrease in mortality amongst the population living within the canal environment. A similar study by Matthew White and colleagues also investigated how living near the sea can impact human health, and this showed that individuals living in England reported better general and mental health when they lived near the sea, specifically within 5 kilometers off coast. On the other hand, a systematic review conducted by Maria Gascon and colleagues that aimed to synthesize quantitative evidence on the benefits of outer blue spaces on human health and well-being showed that a good quality of evidence demonstrated positive associations of exposure to outer blue spaces and benefits on mental and physical health and well-being. Another systematic review by Eski Breton and colleagues that aimed to understand the impact of blue spaces of individuals leading therapeutic interventions showed that blue space interventions that had been specifically designed for therapeutic purposes or blue care had direct benefit on health, especially on mental health and psychosocial well-being, as well as social connectedness of patients provide with blue care. So what it is in blue spaces that positively influence our health and well-being? In a review conducted to understand how blue spaces provide health benefits to people, authors Sebastian Volker and Thomas Kesteman propose a concept that can be used to characterize, analyze, and understand the salutogenetic health effects of blue spaces. In the concept, Volker and Kesteman emphasize four appropriative dimensions of blue spaces, specifically experience space, social space, symbolic space, and activity space. Experience space is the physical space of natural and built environments in blue spaces characterized by territoriality, the natural environment, the water in the blue space, the sense of place, removal from everyday stress, and the meaning of the place to the individual. This experienced space is associated with the perception and preference of an individual as well as landscape design. Social space is connected to shared rituals, pilgrimage, contested reality, historical context, everyday activities, equality, social relations, and healing that a person gets from the blue space. This is widely associated with the perception, preference, emotional as well as the direct health benefits that one experiences in a blue space. Symbolic spaces is strongly associated with the spiritual connection and value that some people experience with the blue space. This widely connected to symbolisms of a healing God with supernatural and healing powers, the role of faith, transformation, beliefs, philosophies, and perceptions of people about blue spaces, which focuses more on the religious meaning of blue spaces translated as emotional health benefits. Lastly, the activity space, which is an additional dimension to the existing concept of therapeutic landscapes, considers human behavior and activity in blue spaces. Blue spaces are highly used for recreational activities and purposes which have restorative and recreational benefits. Aside from these appropriative dimensions, Volcker and Casteman also provided a set of five substantial dimensions where these four appropriative dimensions could take place. These are naturalistic, built, humanistic, structuralist, and post structuralist dimensions. Blue space interventions are included in the environment side of social prescribing. It utilizes four pathways of blue spaces for health and well being, which coincides with the properties of natural environments that affect attention restoration. These pathways include stress reduction and restoration, environmental improvement, physical activity, and social activity. In the UK, various initiatives have been implemented that utilize natural environment in promoting health and well being. The Green Exercise Partnership in Scotland, Nature Prescription in Shetland, Head to Nature in Northern Ireland, and Wave Project in Cornwall are some of these examples. On the other hand, green pharmaceutical prescribing is a drug prescribing practice guided by environmental criteria for drug selection. Studies suggest that this requires the development of an environmental classification of medicines and behavioral changes in established pharmaceutical prescribing practices. The adoption of a blue green prescribing strategy is investigated in the context of the Scottish healthcare system due to the following reasons. There are initial information about the state of pharmaceutical pollution in Scotland's water environment. Secondly, there are stakeholders' recommendations on preventing pharmaceutical pollution and antimicrobial resistance in Scotland, which needs to be further investigated in a context based manner. There are also recommendations to explore the adoption of nature based and nature sensitive prescribing mechanisms that could help in the prevention and reduction of pharmaceutical pollution in Scotland. My research merges two strands of intervention, such as blue space prescription and green pharmaceutical prescription to patients to improve either physical, mental, and social health and well being. However, the adoption of blue green prescribing strategy, such as requires a systematic, context based, and in depth investigation. This kind of investigation will prevent haphazard implementation of interventions that could cause a program infidelity, harm to patients, production of wrong outcomes, and wasting and inefficient use of resources. For the first phase of my research, I answered the question what are the mechanisms of prescribing blue space interventions in green pharmaceuticals in the context of health and social care settings. I did this by systematically curating, scoping, evaluating, analyzing, and synthesizing existing evidence about the research question. Through this systematic review, I developed the initial blue green prescription model that looks like this. The model can be further explained by this referral pathway that presents who prescribes blue space interventions, for whom and what health condition it is being prescribed for, where it is being prescribed, what specific blue space interventions are being prescribed, and what outcomes are being investigated. It highlights different implementation theories or organizing principles that support the pathway. This pathway establishes that health and social care and trained allied workers employed in health, social care, and specialized facilities prescribe blues-based interventions to individuals who are experiencing common mental health problems such as depression and anxiety and other physical activities with the help of link workers or coordinators of community-based health and social care interventions. Patient enrollment, engagement, adherence, effective communication channels, and program sustainability are organizing principles for prescribing blues based intervention. Patients will enroll to blues based intervention programs if they develop positive beliefs and perceptions about the effectiveness of the intervention through provision of clear information using prescription visuals. Patients will engage to prescribe blues-based intervention program if they are provided with free access, equipment, and transport to a socially inclusive and pristine blues-based environment. Patients will adhere to prescribed blues-based intervention programs if they are satisfied with the improvements in their health and social well-being through blues-based activities delivered by trained and receptive social or service providers. Blues-based intervention program promotion and implementation will be successful if there are established coordination, communication, and feedbacking mechanisms among prescribers, patients, link workers, and service providers. Lastly, the implementation of blues-based intervention programs will be sustained if there are sufficient stakeholders, funding, and trained service providers supporting the intervention delivery. The wise list concept promotes stepwise recommendations of 300 core and complementary medicines. It includes easily understandable messages for improving therapeutic practices used by physicians and prescribers in the Stockholm region. There are 5 organizational units that consist the wise list model. First, there is a systematic introduction of new and expensive medicines following the process of horizon scanning and transparent selection of medicines using 5 main criteria. Second, there is accessible pharmaceutical information and practice powered by information technology. Third, there is program financing for management and organizational support. Fourth, there is a strong medical leadership and collaboration with other professions and institutions. And lastly, there is a monitoring system of prescribing behavior in the region. There are also 4 key strategies that support the implementation of this concept. First, there is a highly functioning and independent drug therapeutic committee composed of committed experts in the field. There is also a financial incentive system that for prescribers who are effectively using the intervention. Third, there is a medicine policy strategy which is run by a focused and strong medical leadership. And lastly, there is a comprehensive communication and medical education strategy using social marketing and branding with communication materials available to both patients and prescribers. From these 2 models, I developed an initial model for Blue Green Prescribing focusing on common mental health disorders. The Blue Green Prescribing model for patients with common mental health disorders is a stepwise prescribing mechanism by referring patients to blues-based interventions and psychological therapy based on the severity of their mental health condition as a first line of defense. Second, prescribing antidepressants with less environmental impact as a second line of treatment. And lastly, the conventional pharmacological therapies as last option for treatment. This prescribing scheme will be integrated in the Scottish Intercollegiate Guidelines Network as short focus advice for prescribers in 2 Scottish health boards such as NHS Highland and NHS Greater Glasgow and Clyde. The model has 4 programmatic elements. First, a systematic environmental classification and labeling of medicines prescribed for patients with common mental health problems, a color scheme of electronic prescriptions accessible to third-party service providers, collaboration with health, environment, water, patient groups, and community-based organizations, and lastly, establish monitoring tool for prescriptions with established indicators to measure health and environmental outcomes. For implementation, strategies will support the model. First, a green medicine and social prescribing policy, a communication and capability building strategy, program resources to support the implementation of the intervention, and lastly, a recognition and incentive system to motivate prescribers and service providers in implementing the intervention. With the increasing prevalence of common mental health problems, the increasing demand for mental health services and antidepressants, and the limitation in accessing and adhering to these services, the integration of blue green prescribing as an alternative referral pathway will not only improve mental health outcomes but will also contribute to improving environmental outcomes and water quality in Scotland. However, a further investigation using policy and network analysis will be done to understand how blue green prescribing can be integrated in sign and how identified sectors will interact in adopting the intervention. A deeper investigation will be done using qualitative and quantitative methodologies to understand the deeper and wider perceptions of actors about the adoption of the intervention in Scotland. Considering these perceptions, a co creation activity will be done to develop the final and context driven blue green prescribing model that is bespoke for NHS Scotland. Recently, I have interviewed 40 key experts from these sectors to explore the feasibility, accessibility, and sustainability of implementing blue green prescribing in Scotland. I also explored potential barriers and opportunities for implementing such strategy. Results from these key informant interviews will be used to refine the initial blue green prescribing model, the development of survey questionnaire that I will be administering to health and social care workers across Scotland, and the key implementation strategies that we'll explore in the co-creation workshop with GP practices and different NHS health boards. If you are interested about the Blue Green prescribing research and would like to get involved in the survey and co-creation workshop that I will be implementing with healthcare workers and GP practices during the later part of the year and next year, please feel free to contact me through my email address or connect with me in Twitter or LinkedIn. Thank you very much for your time and checking my presentation.